Hey Alpha Nurses, I'm Nurse Sandro from alphanursguide.com. This is NCLEX PN Review Lesson 38, Neurological Disorder Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates on new notes. You can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the way, let's get started.
Question 1. The client with a cervical spine injury has Crutchfield tongs applied in the emergency department. The nurse should perform which essential action when caring for this client? A. Providing a standard bed frame. B. Removing the weights to reposition the client. C. Removing the weights if the client is uncomfortable. D. Comparing the amount of prescribed weights with the amount in use. The correct answer is D. Comparing the amount of prescribed weights with the amount in use. Rationale: Crutchfield tongs are applied after drilling holes in the client's skull under local anesthesia. Weights are attached to the tongs, which exert pulling pressure on the longitudinal axis of the cervical spine. The nurse ensures that weights hang freely and that the amount of weight matches the current prescription. The client with Crutchfield tongs is placed on a striker frame or rotorest bed. The nurse does not remove the weights to administer care or change the level of tension or traction based on client comfort level. Question 2. The nurse has provided discharge instructions to a client with an application of a halo device. The nurse determines that the client needs further teaching if which statement is made. A. I will use a straw for drinking. B. I will drive only during the daytime. C. I will use caution because the device alters balance. D. I will wash the skin daily under the lamb's wool liner of the vest. The correct answer is B. I will drive only during the daytime. Rationale: the client should not drive because the device impairs the range of vision. The halo device alters balance and can cause fatigue because of its weight. The client should cleanse the skin daily under the vest or the device to protect the skin from ulceration, and should use powder or lotion sparingly or not at all. The wool liner should be changed if odor becomes a problem. The client should have food cut into small pieces to facilitate chewing and use a straw for drinking. PIN care is done as instructed. Question 3. The nurse is caring for the client who has suffered spinal cord injury. The nurse further monitors the client for signs of autonomic dysreflexia and suspects this complication if which sign/symptom is noted. A. Sudden tachycardia. B. Pallor of the face and neck. C. Severe, throbbing headache. D. Severe and sudden hypotension. The correct answer is C. Severe, throbbing headache. Rationale: the client with spinal cord injury above the level of T7 is at risk for autonomic dysreflexia. It is characterized by a severe, throbbing headache, flushing of the face and neck, bradycardia, and sudden severe hypertension. Other signs include nasal stuffiness, blurred vision, nausea, and sweating. It is a life-threatening syndrome triggered by a noxious stimulus below the level of the injury. Question 4. The client with spinal cord injury is prone to experiencing autonomic dysreflexia. The least appropriate measure to minimize the risk of autonomic dysreflexia is which action? A. Strictly adhering to a bowel retraining program. B. Keeping the linen wrinkle-free under the client. C. Avoiding unnecessary pressure on the lower limbs. D. Limiting bladder catheterization to once every 12 hours. The correct answer is D. Limiting bladder catheterization to once every 12 hours. Rationale: the most frequent cause of autonomic dysreflexia is a distended bladder. Straight catheterization should be performed every 4 to 6 hours, and indwelling bladder catheters should be checked frequently for kinks in the tubing. It is not appropriate to catheterize the client every 12 hours. Constipation and fecal impaction are other causes, so maintaining bowel regularity is important. Other causes include stimulation of the skin from tactile, thermal, or painful stimuli. The nurse administers care to minimize risk in these areas. Question 5. The client with spinal cord injury suddenly experiences an episode of autonomic dysreflexia. After checking vital signs, which immediate action should the nurse take? A. Raise the head of the bed and remove the noxious stimulus. B. Lower the head of the bed and remove the noxious stimulus. C. Lower the head of the bed and administer an antihypertensive agent. D. Remove the noxious stimulus and administer an antihypertensive agent. The correct answer is A. Raise the head of the bed and remove the noxious stimulus. Rationale: key nursing actions are to sit the client up in bed, remove the noxious stimulus, and bring the blood pressure under control, with antihypertensive medication per protocol. The nurse can also clearly label the client's chart, identifying the risk for autonomic dysreflexia. Client and family should be taught to recognize and later manage the signs and symptoms of this syndrome. Question 6. The nurse is assigned to care for an adult client who had a stroke and is aphasic. Which interventions should the nurse use for communicating with the client? Select all that apply. A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. D. Avoid the use of body language when talking to the client. E. Give the client directions using short phrases and simple terms. F. Phrase what was said differently the second time, if there is a need to repeat it. The correct answers are A. Face the client when talking. B. Speak slowly and maintain eye contact. C. Use gestures when talking to enhance words. And E. Give the client directions using short phrases and simple terms. Rationale: a client who is aphasic has difficulty expressing or understanding language. The nurse should face the client when talking, establish and maintain eye contact, and speak slowly and distinctly. The nurse should use gestures and pantomime when talking to enhance words, and use body language to enhance the message. The nurse should give the client directions using short phrases and simple terms, and phrase questions so that they can be answered with a yes or no. If there is a need to repeat something, the nurse should use the same words a second time. Question 7. The nurse is admitting a client with Guillain-Barré syndrome to the nursing unit. The client has an ascending paralysis to the level of the waist. Knowing the complications of the disorder, the nurse should bring which items into the client's room? A. Nebulizer and pulse oximeter. B. Blood pressure cuff and flashlight. C. Flashlight and incentive spirometer. D. Electrocardiographic monitoring electrodes and intubation tray. The correct answer is D. Electrocardiographic monitoring electrodes and intubation tray. Rationale: the client with Guillain-Barré syndrome is at risk for respiratory failure because of ascending paralysis. An intubation tray should be available for use. Another complication of this syndrome is cardiac dysrhythmia, which necessitates the use of ECG monitoring. Because the client is immobilized, the nurse should routinely assess for deep vein thrombosis and pulmonary embolism. Question 8. The nurse is caring for a client with an intracranial aneurysm who was previously alert. Which finding should be an early indication that the level of consciousness is deteriorating? A. Drowsiness. B. Clear speech. C. Ptosis of the left eyelid. D. Frequent spontaneous speech. The correct answer is A. Drowsiness. Rationale: early changes in level of consciousness relate to orientation, alertness, and verbal responsiveness. Less frequent speech, slight slurring of speech, and mild drowsiness are early signs of decreasing LOC. Ptosis of the eyelid is due to pressure on and dysfunction of cranial nerve 3 and does not relate to LOC. Question 9. The nurse is planning to put aneurysm precautions in place for the client with a cerebral aneurysm. Which item should be included as part of the precautions? A. Limiting cigarettes to 3 per day. B. Allowing out-of-bed activities as tolerated. C. Maintaining the head of the bed at 15 degrees. D. Allowing 1 cup of caffeinated coffee per day. The correct answer is C. Maintaining the head of the bed at 15 degrees. Rationale: aneurysm precautions include placing the client on bed rest, with the head of the bed elevated in a quiet setting. Lights are kept dim to minimize environmental stimulation. Any activity such as pushing, pulling, sneezing, coughing, or straining that increases blood pressure or impedes venous return from the brain is prohibited. The nurse provides all physical care to minimize increases in blood pressure. For the same reason, visitors, radio, television, and reading materials are prohibited or limited. Stimulants such as caffeine and nicotine are prohibited. Decaffeinated coffee or tea may be given. Question 10. The nurse is caring for a client who begins to experience seizure activity while in bed. Which action by the nurse would be contraindicated? A. Restrain the client's limbs. B. Loosen restrictive clothing. C. Remove the pillow and raise the padded side rails. D. Position the client to the side, if possible, with head flexed forward. The correct answer is A. Restrain the client's limbs. Rationale: nursing actions during a seizure include providing privacy, loosening restrictive clothing, removing the pillow, and raising the padded side rails in bed, and placing the client on one side, with the head flexed forward, if possible, to allow the tongue to fall forward and facilitate drainage. The limbs are never restrained, because the strong muscle contractions could cause the client harm. If the client is not in bed when seizure activity begins, the nurse lowers the client to the floor, if possible, protects the head against injury, and moves furniture that may injure the client.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.